In Section 3, we talked about consent and briefly about shared decision-making. In this section, we focus on decision-making in care, how to ensure you are as involved as you need and want to be, and how treatment options are chosen. We will also look at what might help you prepare for and recover from treatment. Your voice, your wishes, your preferences are as important as medical experience and clinical research evidence, and may even be more influential when it comes to the choices and decisions you make. This statement is about understanding not only the clinical, but also personal situation you are in at the time of decision making. Understanding and including these considerations is an essential part of both informed consent and shared decision making. As mentioned in Section 3, shared decision-making is a process through which clinicians and patients work together to select tests, treatments, management or support packages based on clinical evidence and the patient's informed preferences. Not only has research from the UK and other countries suggested that shared decision-making can improve people's knowledge about their condition and treatment options, people's involvement in their care, people's satisfaction with care, people's self-confidence in their own knowledge and self-care skills, people's relationships with health and care professionals, and professionals' communication with patients. It is a legal right, incorporated into current healthcare principles. In other words, it's not just information about the recommended treatment, but all reasonable alternatives. In shared decision-making, the healthcare professional is seen as an expert on the specified disease or condition, as well as the effectiveness and potential benefits and harms of treatment options. The patient is seen as an expert on themselves, their circumstances, attitudes to illness and risk, values, preferences, and the extent to which treatment options might fit within their lifestyle. This also includes a need to be open about any other factors that may affect health decision-making. For example, whether there is use of non-prescribed medications, supplements, and/or complementary therapies. But making decisions about cancer care can be complicated, and some aspects may require further explanation, such as technical wording. Medical terminology may need explaining, as wording may be unfamiliar to many people outside of healthcare. Consequences of medical procedures, where both short and long-term effects may not be immediately clear. This needs discussion. Health risks and probabilities, and how this information may apply to you. For example, if a treatment has a 25% chance of benefit, what was it about that 25% that led to treatment success? Do you have any of those factors? Or is your situation or disease status more similar to the 75% where there was no benefit? While you may be willing to accept a higher risk for a potential benefit, it is important to be sure of the real risks associated with this, and that your expectations, your hopes of treatment are realistic and grounded in fact, even if the facts themselves may be limited. Multiple options for care, where a number of treatment options may be offered. Choosing one can seem overwhelming. Both the healthcare professional and the patient need to be willing and able to effectively share information and accept responsibility for doing so, to safely ensure joint decision-making.